In my experience, the 5 most common questions asked by a patient after a diagnosis of prostate cancer are: I've heard that most prostate cancer does not need to be treated. Is my prostate cancer one that will need to be treated? And I think the answer to that is it all depends on the initial diagnostic biopsy. It depends on what the PSA was, it depends on what the Gleason score is, and it depends on what the prostate feels like clinically. And I think the second part of that answer is each man is an individual person, and each man may have other diseases that may take their life before prostate cancer. So the answer to that question is a very individual answer. And if they have aggressive prostate cancer and they're young and healthy, that's a pretty no-brainer. I think you need treatment. If you have a very slow-growing prostate cancer, you're elderly, and you have multiple medical conditions, then that's also a very straightforward answer. Meaning that it probably can be watched. It's the men in the middle, the men who have what's called intermediate risk prostate cancer. They have some medical illness. They're not 90, but they're not 50. And those are the gray areas. And I think that's where a urologist can help out, a radiation oncologist can help out, as well as your family doctor can help out in terms of answering that question. I think the second most common question men often ask is, what are my treatment options? I think there are 3 main treatment options for prostate cancer. Treatment number 1 is if your prostate cancer is a very slow-growing garden variety prostate cancer. The treatment is called active surveillance. Option number 2 for treatment of prostate cancer would be using radiation therapy. The final option for treating prostate cancer is radical surgery in terms of removing the entire prostate and accessory glands around the prostate, either by doing open radical prostatectomy, laparascopic radical prostatectomy, or robotic-assisted laparoscopic radical prostatectomy. The third most common question often asked by men with a new diagnosis of prostate cancer is, what is the impact on sexual function? The impact on sexual function varies whether or not a man has radiation treatment or surgical treatment for their prostate cancer. Obviously, with active surveillance, there is no impact on sexual function because there is no treatment and your sexual function remains as it was. In terms of radiotherapy for prostate cancer, radiation treatment minimally affects sexual function initially, but as the radiation changes the tissue structure of the organ, sexual function may be impacted down the road, i.e. maybe 2 or 3 years after the initial radiotherapy. I think there's a huge impact on sexual function with radical prostatectomy, whether it's done open, whether it's done laparoscopically, or whether it's done robotically, and whether or not there's nerve sparing involved or not. Having said that, if there is problems with sexual dysfunction after surgery, it is recoverable, and there is alternative things that we can do to achieve an erection. The fourth most common question in a newly diagnosed prostate cancer is, what are my options beyond radiotherapy, beyond surgery? There is other energy-based treatments for prostate cancer, such as cryotherapy, which is offered in Alberta next door, and there's also high-intensity focused ultrasound. The fifth most common question asked by patients regarding a new diagnosis of prostate cancer is, how is radical prostatectomy performed, and what are my options in this province for radical prostatectomy? The answer to that is 90% of urologists in this province perform radical prostatectomy using an open technique, where there is a lower midline incision below the belly button and the abdomen is opened, and the prostate is removed via an old-fashioned open technique.